Well, let's come to the head of public health at Exeter University. This is Dr. Bharat Pankaneer. Good morning, Doctor. Funneling all the information and filtering it here at this end, kind of journalistically, we are undoubtedly left with the impression that we have become somewhat rudderless in this country in terms of the rollout of the booster vaccines. That whereas we had somebody very much in charge with their hands on the rudder in the rollout of the first two vaccine programmes, it's all drifted. Clearly the boosters aren't being rolled out fast enough. Clearly they're the first-line solution to the problem, but we just seem to be becalmed. Is that your sense as well? That we've lost leadership on this now?
Well, the primary care that did a magnificent job, and by primary care I mean general practitioners, did a magnificent job in delivering the vaccines program. With respect to the boosters, unfortunately, and it is really unfortunate that Secretary of State for Health and Social Care has insisted that you need to do more face-to-face consultations and more GP activities. So the GPs cannot do both, which is run the booster program, especially in care homes where actually you have to take your team with you and go there and deliver the vaccines. So many GP practices have been pulling out of delivering the booster program. And as a result, care homes, like our panelist has mentioned, may not get their vaccines in time.
So are you actually saying then that this morning there will be a GP in practice, maybe with his colleagues, saying we really should be going to X and Y care homes this morning to deliver these booster jabs, but we can't because we have to do surgery, so we're going to have to put it off for another day? Is that what's happening?
That is true, yes. Not in all cases, but they can't be in all places at all times. And this is a clear example, again, of primary care, GP practices being under-resourced. They can run big vaccination centres because there is economies of scale. Whereas with respect to having a team that goes from nursing home to care home is difficult, and they've been made forced to make choices because of this insistence on you will do more face-to-face consultations and other primary care work.
Dr. Pankaneer, you can also get the booster in pharmacies. Is there a role for pharmacists to be going out to care homes, to vaccination hubs? I mean, what changes do you think need to be made in the booster programme to make it work effectively? Because we're reliant on it right now. It's our plan A.
So once upon a time, when we had an integrated care, i.e. public health, primary care, secondary care, we all talked together and worked together, we would have set up a task force, a properly funded task force who could go, exactly as you mentioned, to care homes, to set up hubs, to set up pharmacies, etc., to do all this. At the moment, unfortunately, it is very much little bits and pieces in an uncoordinated manner, which is a shame.